Many people who have STDs don't know it. They may look healthy, but they still have an STD. And then there are people who won't tell you, and they know. So how do you know if you're infected with a sexually transmitted disease? Well, first of all, you may have noticed some symptoms.
For men and women alike, you may develop sores, bumps, or blisters near your genitals or mouth, or feel a burning pain while you urinate. Women may experience itching or unusual odor or discharge, a bellyache, or bleeding between periods. Men may have pain, dripping, or discharge from the penis or anus. But remember, sometimes symptoms don't show up for weeks, months, or years. If you're not sure, the only way to really know is to go to the health clinic and get tested.
Okay, you guys, I know you've heard a lot, but out of everything that you've heard, this is most important. Now, there's only one way to completely avoid getting most STDs.
Abstinence, condoms.
Abstinence. Okay. Using a condom, knowing your partner.
Abstinence.
I'm married, so okay. No sex and wait till you're ready, when you're really ready.
Abstinence. That is not having sex of any kind. That is the best way to protect yourself. Close, intimate contacts always puts you at risk. If you have sex, choose only one partner who you know and trust, someone who only has sex with you. Limiting your number of sex partners will reduce the risk of getting a sexually transmitted disease. And if you're going to have sex, use a latex condom and protect yourself. Now, if you are sexually active, especially if you have multiple partners, get tested regularly for STDs. Now, this does not mean that you will prevent from getting infected, but it may catch the disease before it gets worse or spreads to other sexual partners. Okay, you guys, so today we talked a lot about different types of STDs. How do you get them? And most importantly, how do you keep from getting them? But what we need to talk about now is, if you think you have an STD, what should we do about it? Your local county health department has professional staff ready to give information, help analyze, and even conduct medical testing to confirm whether or not you've been infected by an STD. And these professionals understand just how sensitive this matter is to you. So whatever information you give them, it is completely confidential. That's right, you guys, your secret is safe with them. But to know for sure, you still need to come in and have a test done. The staff can't make such a sensitive diagnosis over the phone. Different types of treatments are given for each STD. There are some that involve taking a pill, and there are others that involve getting a shot to kill the organism that caused the STD. Some STDs are viruses and can't be cured, but there are treatments that ease the symptoms and stop the damaging to your body. The treatments of these viruses include pills, topical creams, freezing or burning of the infected area, or even surgery. But be sure of one thing: the fear or the embarrassment of treating and testing the STD is far less painful than leaving it and passing it to others. Be safe, be smart, get tested. Okay, you guys, I hope we've helped you better understand STDs today and to be more aware of the risks involving sexually transmitted diseases. Now remember, prevention and caution are still much easier pathways to walk than treatment for STDs, or worse yet, having to be the victim who suffers from one. Be smart, protect yourself, and protect those you love.
If you need help, would like more information, think you need to be tested, or would just like to talk to someone about sexually transmitted diseases, call the Genesee County Health Department's hotline, 810-257-3440, or stop in the health center located in downtown Flint on 630 South Saginaw.